Hello, good afternoon, friends. Today, little bit late to discuss a very small remedy. And before explaining that remedy, I want to share a short case. In fact, it is a chronic case. But the patient came to me after a long period of suffering. He was nearly about 65, 70 years of age, a diagnosed case of rheumatic heart disease, who came to me along with a weak heart, used to get a lot of palpitation, the breathlessness, and he was labeled as a rheumatic heart disease patient associated with the rheumatism at that specific time. So, the, whenever the rheumatic heart disease is there, I used immediately our mind favor of certain remedy. The main remedies in rheumatic heart disease, as we learn, is the Kalmia Latifolia, or second is lithium carbonicum. These are the remedies which are having very specific action in the rheumatic heart disease. So I took the details of that patient, and he explained that, doctor, this has started nearly about 10 years back, and it started in my both shoulders and both hips at a time. There was a swelling and I could not able to move both the shoulders, and the same thing happened in my hips and I was not able to move. It was so painful, and someone have given me some medicine. I have started with that medicine, and thereafter I felt little bit better, and then it gradually tapered down to my elbows. In the lower extremity, it has tapered to knees, and thereafter it goes to the small joints of the hands and small joints of the feet. So this was very typical with that patient. It is interesting. The rheumatism which has started in upper extremity or in upper part of the extremity and going down, descending type of rheumatism was there. Generally, if it is ascending, we can think of a remedy very early. It is a lead and palm, we know. But this is a descending rheumatism, and it was the pains were very typical, that as if a rheumatic patient complains that darting pain, shifting pains, the severe pains, the heaviness over there, all those things were there associated with the weak heart. So I checked his pulse, and pulse found to be nearly about 40 to 50, and it is feeble. It doesn't have a strength, and patient was weak enough. When he was talking not loudly. His sound was also weak, and this is because his heart is weak and not able to cope up, and that's what the case was. So ultimately, I have started with the same remedy which I have mentioned, that Kalmia latifolia, the 30 potency with which I have started the case, and I have repeated little bit, nearly about a week period, and thereafter I have kept that patient on the placebo. After 15 days, patient came to me, and he was happy in two sense. First important thing, his pains were much better than earlier, and second important thing, that he was gaining little bit strength. What he said after entering in my room, doctor, I'm able to walk certain distance which it was not possible since long time. I'm tremendously happy because of it. So I have kept that patient again on placebo and have waited for another 15 days, and he was improving day by day. At certain time, the little bit aggravation of the joint complaints came. So I have shifted from Kalmia from 30 to the 200 Q doses, followed with the placebo, and patient has steady improvement thereafter. His strength improved, his loud voice becomes loud, he was able to walk, his dyspnea disappeared, and his rheumatism decreased a lot. So this was a very interesting case and has a very typical Kalmia features. And Alan has mentioned little bit about it. We'll learn this remedy from Alan's keynotes. He has not mentioned, I think so, so much of symptoms from the heart, but he has mentioned the characteristics of the Kalmi. So let us go ahead with the what he says in the Kalmi. So Kalmia Latifolia, it is a mountain laurel. Family is Ericaceae, adapted to the acute neuralgia, rheumatism, gouty complaints, especially when heart is involved as a sequelae of rheumatism or gout. See, this is first sentence defines you the direction that suppressed rheumatism or rheumatism leading toward the heart complaints. Think of this remedy. Same is true with the lithium carbonicum also. So both remedies are where first important remedy should struck your mind whenever the rheumatic heart disease patient is there. So this is very specifically he mentioned, and it is one more thing which is common with this Kalmia is that rheumatism is associated with numbness of the affected part. That is another characteristic of Kalmia. In heart diseases that have developed from rheumatism and or alternate with it. So both things, the rheumatism leading to either um, heart disease or heart symptoms alternate with rheumatism. Pains are very characteristic. Pains are sticking, darting, pressing, shooting in downward direction. This is written in italics. One more remedy is there, that is the cactus. Cactus is also having a downward direction. And then upward, he has mentioned, it is the ledum palm. In Ledampal, the rheumatism is going in upward direction, and cactus and Kalmia, where the downward direction is there, attended or succeeded by the numbness of the affected part. So, rheumatism with the numbness of the affected part, that is also given in italics. So, that has a significance. In aconite, it is having, in chamomilla, it is having, in platina, it is having, but every remedy carries their own characteristics. Naphthalum is having numbness of the affected part, but naphthalum it is sciatica which is developed over there. In aconite, the pains are so strong, aconite and chamomilla, that pains itself produces a numbness over there in both remedies. Platina, the gradual development of the numbness which develops in platina, the pains are gradually appearing and gradually disappearing, and that it settles, it develops a gradual numbness in case of platina. Severe itching pain in the right eye and orbit. See, itching of the right eye, itching of the right orbit, very typical. Side determination is very important. If it is left, then it is a spigelia. See the difference. This is the characteristic which these are the characteristics which we have to consider when we consider homeopathically. These are very essential. Sometimes some patients come to you with very specific left-sided orbital neuralgia. The spigelia is very strongly coming remedy, which is also having the action on the heart, where you can get the palpitations associated with that. Severe pain in right eye and orbit, left eye, the spigelia, stiffness in the muscles. Pains are aggravated by turning the eyes, like spigelia. Even they turn the eyes, the pains gets aggravated. So pain in eyes aggravated by turning the eyes. Begins at sunrise, aggravated at noon, and leaves at the sunset. So these are eye complaints which starts with the day, begins with the day, and gradually increases in the afternoon and decreases in the evening. These features are generally related with the migraine complaints. That's why Natramur is mentioned over there. These modalities are applicable with the psychotic miasm, so daytime aggravation. But this is regarding the specifically the as the sun arises and sun goes to the top, the complaints gets aggravated, and this is very close to the Natramur. But Natramur, it is not eye complaints. Basically, Natramur headache is aggravated in the similar manner. Rheumatism. How is the rheumatism? Rheumatism changes place suddenly. Going from joint to joint, joints are hot, red, swollen, worse from least motion. So slightest motion aggravates the pain. It is inflammatory rheumatism. That's why the rheumatic heart disease develops after inflammatory rheumatism. Rheumatoid arthritis. Generally, it is a systemic disease which involves the whole system. So it is one of the important remedies which you have to take into consideration while considering that. Vertigo, when stooping or looking down. Vertigo when stooping or looking down. When you look down, when you stoop, there is a vertigo. Another remedy which is mentioned in bracket is Phygelia. These two remedies are very close to each other. Only the sides are different. Spigelia, it is left-sided. The Kalmia, it is the right-sided. Then heart complaint, which he has mentioned. The pulse, slow, scarcely perceptible, 30 to 40 per minute. So this is very important thing in generally rheumatic heart disease. When the congestive cardiac failure used to happen, there is a weakness in the heart. The muscle cardiomyopathy sometimes develops, and heart never has the capacity to produce a forceful contractions. This remedy is the wonder. So pulse is slow, scarcely perceptible, 30 to 40 per minute, pale face and cold extremities. The coldness of extremities is secondary to the circulation. The slow circulation leads to the cold extremity. See the relation? Thus, it is similar to the ledum rhododendron, the spigelia in rheumatic affections and gout. See, very important. The remedy is very close to the ledum, but ledum it is ascending rheumatism. Kalmia it is descending rheumatism. In ledum, the patient feels better after the ice cold water application. In rhododendron, it is very close to the rustox. That damp cold weather aggravates the complaints. It produces acute rheumatism. In rhododendron, there is a chest rheumatism. The ribs or intercostal rheumatism you can get in the rhododendron. Generally, in case of males, it is associated with the hydrocele also. Spigelia, as already we have discussed, it is exactly the opposite. Site determination plays very important role. So these are three remedies which you must compare with in relation with the rheumatic affections as well as gout. It follows Spigelia well in heart disease. So after Spigelia, you can think about this remedy. If the circulatory failure is more marked, so after Spigelia, you can think of the Kalmia. And as both are having a action exactly opposite to each other, they complement each other. So opposite remedy or remedies which have an opposite action generally complements one another. So these are the things which one has to consider and always keep it in your mind. The first sentence of the remedy, rheumatic heart disease, bas, that's all. Keep it in your mind. Lithium carb and Kalmia. So you'll never forget. If you make such thoughts in your mind, then immediately you can reach to the pathology and you can understand the remedy in a better perspective. So this is what we have to learn. It's a short session today we have done because already it's too late. I want to see my OPD. So thank you very much. Thank you, sir. Jayesh Sagar sir or sir is there. Thank you for attending session. Harshal, Amit, thanks a lot. We'll meet tomorrow again with some more remedy. We'll meet and thanks.